I'm Dr. Jacqueline Plemons, President of the Texas Dental Association. I'm here to give you an update on the state's COVID-19 vaccine distribution plan and how it affects dentists. First, I want you to know that we're advocating hard for Texas dentists and dental teams to be vaccinated. We'll never stop fighting for our members. We understand you're anxious for the vaccine and to know where we stand in the process. We hear you and we understand you. As a dentist, I know firsthand the importance of this issue. Second, while we work tirelessly on your behalf, there are still many factors in Texas's vaccine distribution process which affect the order in which dentists and their team members will be able to access the vaccine. On December 18, 2020, TDA met with state leaders along with representatives from other healthcare industries to discuss state's COVID-19 vaccine distribution plan. Texas is preparing for the second vaccine allocation that should include the Moderna vaccine as part of the state's overall estimated allocation of 1.4 million COVID-19 vaccine doses by the end of December. However, Texas Department of State Health Services Commissioner Dr. John Hellerstedt summarized the situation best. We are in a state of vaccine eagerness in which demand outstrips supply, even for essential healthcare professionals. As TDA reported at the 1st of November, the state of Texas will continue immunizing all first-tier Phase 1A frontline hospital workers, long-term care facility workers and residents, and vulnerable populations identified in the state's vaccine guidelines, and keeping with the state's primary strategic goal of maintaining a healthcare system in which any COVID-19 patient needing a hospital bed has a hospital bed. The speed at which vaccinations can be done depends on many constantly changing factors. Things like the number of vaccines ultimately approved, how quickly Texas will receive its allocated vaccine dosages, and whether Governor Abbott and DSHS decide to add populations to the first tier of Phase 1A, as Governor Abbott did when he decided that Texas would participate in the federal government's long-term care program, requiring the state to allocate a part of each week's vaccine to go to long-term care facility residents. When I say we're working to get you the vaccine, that's not just an abstract statement. We are aggressively advocating for you with key vaccine distribution decision makers, including Texas's expert vaccine allocation panel, DSHS, and elected officials. Advocating for you is our business, but advocacy is not instantaneous, nor is it easy. We must work within a system that can be unpredictable and can move more slowly than we wish it did. But we keep fighting for you, and we stand with you. While our work behind the scenes doesn't stop, the reality is that a final decision when dental professionals can be vaccinated is not yet known. State leaders consider dentists to be infection control experts, and they also consider dentistry a safe profession in which infection control has been and continues to be a top priority. Texas officials know that every day dentists and their teams are providing Texans with dental care under enhanced COVID-19 infection control protocols implemented at the start of the pandemic. Fortunately, TDA has worked overtime since the start of the pandemic to prove to Governor Abbott and his advisors that dentistry is a low-risk profession with proper safeguards in place. It's important to remember that TDA's advocacy resulted in you being able to fully practice today. Much of the work TDA is doing for you is behind the scenes, as many of the state's meetings about vaccine distribution aren't open to the public. While our efforts may not be publicly visible, our goals, our resolve, and our dedication to working for dentists is clear, and we'll continue keeping you informed through regular updates via emails, our website, tda.org, and our Facebook, Instagram, Twitter, and LinkedIn accounts. TDA is optimistic that our ongoing advocacy clearly demonstrates that dentists and their team members are an integral part of Texas' overall healthcare infrastructure and in line with other essential care professionals receiving next access to the vaccine when the shortage ends and the vaccine doses are more abundant. We'll alert you as soon as we know which phase or tier of Phase 1A the vaccine will be available for dental professionals. We'll also share details of the distribution protocol as soon as we have this information. Looking back, I'm proud of how dentists responded to the pandemic, the trust and faith that we've built and continue to instill in our profession. Having a seat at the table while important vaccine distribution decisions are being made is another example of why being a TDA member is so important. There are numerous other healthcare professionals and business industry groups wanting access to the vaccine, but you know that because your TDA membership, key decision makers have dentistry on their minds as they make these decisions. I realize that many of us, myself and my family included, are experiencing COVID fatigue, and that the stress of the unknown about receiving the COVID vaccine is part of that. But we must stay the course for our patients and our profession, and remember that help is on the way. For now, it's paramount that we keep doing what we've already been doing, continuing to practice according to the Texas State Board of Dental Examiners COVID-19 emergency rule and CDC guidelines. Texas needs to know that it's not only safe to go to the dentist, it's better than safe. It's essential for maintaining their overall health and for preventing illness. Through all the stress and upheaval of COVID-19, TDA continues to do what we've always done. We fight for Texas dentists and patients.